me. So just so you know, this meeting will be recorded. And just to introduce myself, my name is Amanda Ondoma. I'm the Human Resource Director for GK Folks Foundation. My pronouns are she, her, they, them are fine as well. Feel free to share your pronouns if you're comfortable, and we'll just roll into it. So we have two presenters today. We have Dr. Ferguson. He was born and raised in Washington, D.C., and has lived in Utah since 2010. And he's board certified in family medicine, but has also practiced emergency medicine for the last 9 years. He's currently working as a chief medical officer for Health Choice Utah. He served in the Army as a physician for 7 years, and he has a passion for leading humanitarian care at home and abroad. His hobbies include destination triathlons, Ballet West events, and exploring new wineries. And we also have Princess Bombik, who is our community health worker, and she is from Liberia, West Africa. She relocated to the US in 2013 to further her education and graduated from BYU, so Brigham Young University, Idaho, with a bachelor's degree in public health in 2018. And for the past 3 years, she's been working as a health educator in the community health worker for the Salt Lake County Health Department. So welcome to you both. And just a reminder that there'll be a survey at the end of this presentation. So if you want to be eligible, you need to participate with your sound on and make sure that your name matches here on here and then also on the survey once you submit it. So I'll turn the time over to you, Princess and Dr. Ferguson.
Thank you, Amanda. Hi, can you guys hear me?
Can you hear me?
Yes, we can hear you both
yes.
now.
All right, great. So Princess, I was going to drive here, but thank you everyone for having me back. I think Princess and I have been on the other side of this, watching others present for the last few months. Now it is our chance to educate on the effects or impact that COVID-19, and in particularly this pandemic, has had on the Black community. And I'm very excited to have Princess join me because she is more on the front line, as you heard that term come up a lot, more so than myself, given my recent change in roles over the last 2 years. So Princess, would you like to start us off?
Yeah.
And just, tell me to do next slide. And I should.
All right. Well, thank you, Amanda, and thank you all for having me here. My name is Princess Bombik, as mentioned. I'm a community health worker for the University of Utah School of Medicine, and I'm also a mentee of the Black Physician of Utah. So today I get to present with my amazing mentor, Dr. Richard Ferguson. So thank you. Next slide. Okay, so today I will be sharing my thoughts on the impact of COVID on the Black community, pretty much how the coronavirus impacted Black and minority communities more than white community. So minority communities, especially Black community, were hit drastically by COVID. During the lockdown, we saw that the virus was killing more Black Americans than any other group of people in the United States. And study even showed that Black America then accounted for 60% of coronavirus deaths in the United States. So why is that? Well, the Black community was dying from COVID in such high numbers due to reasons like living condition. We saw at the early stage of COVID, we were advised to take precautions like isolation, like avoiding crowded areas, staying indoors, not being out in the public. We were advised to do these things, but those things were difficult for Black America to do that. Why? Because we live in crowded housing. Most members of our community live in crowded housing, and in many ways they had to take public transportation to go to run errands, to go to work, and to just do their daily activities. And that made it seem impossible. Well, that made it difficult for them to take those precautions that were advised for them to take. Next.
I'm sorry, Princess, I wanted to let you know the light shifted behind you so we can no longer see you.
Oh, okay, sorry.
That's okay. It's always difficult working from home, truth be told.
Hold on 1 second. Let me do this.
Oh, that's beautiful. Thank you.
Is this better?
Fantastic. Thank
There
you.
we go. Okay. Another factor is employment and risks of being employed. So majority of our community members, they didn't have the luxury of staying home during the lockdown because they had their families to feed, they had bills to pay. And at the time, there weren't much resources for them to like financial resources to help out. So again, it was impossible or difficult for them to comply to they'd stay in those rules that were given to us to do in order to stop COVID. And so they went to work during the lockdown. Next slide. And they were essential frontline workers. They were working in the ICUs. They were in COVID centers, clinics, like taking care of COVID patients. They were in public areas, like working as bus drivers, where they came in contact with more people. And that's where, again, we were hit more drastically than other communities. Next. Okay, discrimination is a big factor. It has been one of the issues that minority community face in the United States for so long. And with regards to COVID, it led to lack of access to healthcare. Now you would think that because our community had higher cases of COVID, higher death rates of COVID, you would think that logically we would be the ones to have testing sites in our communities, to have access to testing kits that we could use at home, but sadly it weren't the case. We didn't have access to insurance. We didn't have access to testing kits. We had community members that were driving to public health centers. Some of them would take public transportation to go to public health centers to get tested. At the time, I was a community health worker on the field, and we saw a lot of like situation like this. And these things, led to us being disproportionately impacted by COVID. Next slide, please. Okay, so now that we have the vaccine, now that cases have decreased and things are back to normal, why are Black or minority communities struggling in COVID waves? Well, next slide. Higher rates of economic and health and mental health hardship is one of the reasons why Black Americans are still struggling to recover from the terrible experiences they had during the lockdown. They are still recovering from the many funerals they had to conduct in their communities. They are still recovering from the traumatic effects situation they saw in the ICUs, for like still trying to recover from those things. And there aren't much mental health resources to help out with that. Lack of trust. Lack of trust is another big reason. I mean, yes, we have the vaccine to stop COVID, but our people are skeptical of getting the vaccine, due to painful history of brutality against people of color. I mean, we learn history of how, our people were used in laboratories for medical research and experiments. And, they have so many trust issue with medicine in the United States due to that. And that's where education comes into play. Next slide, please. So education comes into play, creating outreach. Well, education comes into play and will help positively, creating outreach where community members can freely share their concerns and ask questions, where they can build up trust and where they can freely share their concerns, where they can, meet with people to ask questions without being judged. That can help, build a trust, encourage them to get vaccinated. Next slide. Representation is another factor that could help positively. Lack of diversity in health sector is very huge in the United States, especially in Utah. Hiring community health leaders or members to work with local health department, clinics, or even in schools will help build a trust and assure vaccine safety for community members. Next slide. As a community health worker, my advice on ways to overcome, next slide, my advice on ways to overcome systemic racism and collective trauma moving forward would be a collaboration with minority, collaboration with community-based organization. And I'm going to emphasize on that. That is very important, collaborating with minorities leaders, collaborating with Black church leaders, collaborating with local leaders in our community will really help create that safety for community members to trust the vaccine, and having those community members be the ones to deliver the health messages to their various community is also important. And making sure that those community leaders or workers that are being hired, they are serving a liaison between their community and whatever entities they are working with. I strongly believe that those things will help, create vaccine safety and help us kind of help encourage our community members to get vaccinated and make things better moving forward. Yeah. Again, education is very important, making sure community leaders, community workers are the ones that are delivering the message to their people. Just because they understand their people pretty well, they know the needs of their people, and they can better deliver the message.
Awesome. Well, thank you, Princess. And as some people have seen probably from the last couple presentations, we've been splitting it between the mentee and the mentor. So I will go over to the next part, and I feel that I will just be building off of the framework that Princess has already established for what has led to, unfortunately, a disproportionate or disparate impact that COVID has had on the Black community, mostly in our larger nation. As I've said in many presentations before, a disparity is often not realized until you're about 10% or more of the population. And so when you're well below that, as we are here, sometimes it's not as apparent. And so the numbers sometimes aren't as striking or aren't as high. But there's a history for that. And I'm going to go over a bit of the historical context of, once again, just like SARS-CoV-2, it's not our first SARS-CoV virus, right? If people remember my lectures from 2020 or 2021, this also isn't our first pandemic to hit our nation. So the historical context is the 1918 flu is what I want us to go back to, was unusually deadly. And just imagine, and many are speculating that this was a novel virus as well. Possibly they're suspecting it was also a coronavirus, meaning it was part of it. It derived as a result of jumping from one species and combining with a virus that typically would cause a benign cold-like symptom, such as the coronavirus typically does in humans, that this is what started in Spain and then spread across the world, taking the lives of about 500 million people. But remember, back then, we weren't able to count and have as much data and statistics as, say, Johns Hopkins, or when people see that ticker coming down with CNN, and it could even break out when people were unfortunately being admitted to hospitals, when people were, when they knew people were losing their jobs, they could be more realized in real time, and the people were able to pull that data and they could present it. Well, here we're kind of speculating, but some of the circumstances haven't quite changed beyond the fact that we have significant more medical advances. However, due to systemic and structural racism, a lot of the factors that led to Black Americans having a higher death rate over 100 years ago is still a factor today. And some of those most brutal effects were perpetuated by Jim Crow. All right, so we have to understand that those were many laws that were created to continue many racist practices and ethics that were often developed by not only white Southerners, but also those in the North, but mostly white Southerners. And then it was changed and codified in different ways in other parts of the country, but there were still Jim Crow-like effects, often leading to Black Americans not being able to move much past their slavery beginnings. So now we're about 60 years after slavery has ended, but lack of access to healthcare was still a significant problem. I mean, even then, many people, particularly in the rural South, before a great migration started to go west and north for African Americans, very limited access to care. And then also their living conditions often being quite crowded, as we can see occurring with some refugee communities here within the US. But the other thing I want to point out is social determinants of health. That something was not really a cone acronym or phrase 100 years ago, but those effects are still prevalent as they were prevalent 100 years ago, is still prominent today. They just have taken different forms. And so some of the examples of that would be chronic conditions. So we saw that diabetes, obesity, hypertension often were those conditions when untreated, and they were sometimes more likely to be in African-American communities because of poor access to care led to often African-Americans, when they did have COVID, tended to have a worse outcome, either having long-term complications or death. Housing and food insecurity. Well, a lot of people that were, especially many Americans nationally, but even more so African-Americans, often are living check to check. So any disruption in their income when they're told to stay home or told you can't go into work, that's money they're not able to now accrue to be able to pay their bills and feed their family. Much of this was still occurring 100 years ago. And so that led to significant financial instability within our communities and stopped us from often being able to progress further for almost an entire generation. Incarceration, we have to understand that Jim Crow laws were created in many ways to, they were often laws that dealt with benign infractions, I would say. I would almost frame it in a way of, if you didn't turn on your turn signal today and you're making a right-hand turn, there was a law equivalent written in the South that you could be jailed because you didn't do that. That's how harsh things were for something that would often be very innocuous. Or once again, people were arrested if they did not use a black water fountain or use a black restroom. Once again, what did that do? That led to increased incarceration, often of black males, black women. And then what did they do with a lot of those prisoners? They used them once again to work farmland. So it often didn't really, many Black Americans, particularly in the South, weren't able to move that far away from slave-like conditions. And then also discrimination that Princess spoke about, that occurred very much towards World War I soldiers that were getting ready to head off and return, because I believe this pandemic was from January 1918 to, somebody correct me if I'm wrong, I want to say December 2020, or excuse me, December 1920. But once again, our data isn't as accurate for that time. So next, COVID, particularly in its impact on the Black family, had a bit of a domino effect. And when I say that, and I'll give a brief example here, Black families were more likely to be positive. Part of it is because of living conditions and those social determinants of health. They may not have had the means or afford the ability to have masks. Their employer might not have provided masks at their job. They're told to isolate or quarantine themselves from others in their household, but they don't have a home large enough to do that. There's several generations of family members within a home. So thus more people get sick. Well, some of those people haven't seen a doctor pre-pandemic. So now they had health conditions that they weren't realized at that time, aren't realized until they're admitted in the hospital with COVID. And then they start having pulmonary complications or blood complications that leads to clots in their extremities. So then now you have a wage earner that is possibly pulled out of the family now. And now you have now you also have a child that with earlier versions of the variant, not as highly likely to be admitted, but we also need to understand that if there are pre-existing conditions that weren't observed or treated in adults, that's occurring with children as well. So Black children are at a higher rate of being hospitalized. So once again, this child is pulled out of school. There's a lot of disruptions that occur to the Black family. You can see, we can either call it domino effect or snowball effect, but it builds up where we would have a larger mortality rate, even though our population is smaller compared to the white majority. I think it's about 12.6% right now, but during the height of the pandemic, it's 20% of the 20% of the mortality rate for those that were infected for COVID. And so I tend to look at this particular quote by Black Mother. This was done during 2021 by a survey to Black workers throughout California. And she worked with a particular school system. And as you can see here, it says, I have had to get a doctor's note to get the basic protective equipment. I don't know if some people remember that you almost had to get a note to have permission to wear something at your job, especially depending on the line of work you were in. Once again, this is an employer not being supportive or necessarily protective of their employee. That added stress, trying to protect herself. My workload has been compounded into a shorter period of time. It has strained relationships and it created a more hostile work environment. This is once again, we have possibly an employer not stepping in and putting down a policy that protects all instead of allowing people to opt out. So thus, remember those fights that people were getting into on planes all the time because the airline wanted to put down one policy, but then you had one person saying, I don't want to do it. Not thinking about the health often of others, of their neighbors. This was often multiple fold in the Black community. And to close out her statement, I don't feel emotionally or physically safe or cared for at work. We were offered a total of one mask with the company logo. That's actually not uncommon. I was offered one mask with the company logo at University of Utah. Mind you, I have the ability and I have access to masks all the time, but the fact is, I frequently gave more out than I ever needed to request for myself. And it was often to people of color because masks cost money, they had limited income, and sometimes and then I think we also remember there was a time masks kind of went scarce, particularly with the N95s. So that particular resource wasn't always readily made available to someone that is working your grocery store to feed your family, working frontline, cleaning that hospital room, or working in the clinic, testing you through the driveway testing center, or someone that is trying to educate your children in school. So sometimes for these, you would more often find African-American workers in these roles. I'm going to probably bring up in the next slide, but from a 2016 survey that was done nationally, mind you, it's only based on what people report, but it was believed that 45% of frontline workers, not all frontline workers, but yes, of frontline workers, 45% of them were African-American, which was a higher percentage than I thought. But we understand that if you aren't given opportunity, you are only going to be able to get the job that you're most likely to see or come in contact to, or that's presented to you, or that's in your neighborhood. So to go over some of the metrics and some of the impact by the interventions that occurred by the federal assistance programs, we can see January 2020, the unemployment gap between white and Black and white and Hispanic. And then we can see right around March how that ticks up, particularly for everyone, but the gap was wider between white and Black in regards to employment versus unemployment. And then we start to see as we go down into November and December, that's the impact of the CARES Act and the stimulus checks and the moratorium on evictions. That's what we're seeing here. And then we start to see it wane a bit because then it goes back up more when people are starting to hire and people are being able to go back into work, go back into school. They're starting to travel, but we start to see it increase again because then you had another shutdown. And so that's when you start to see this spike again right around July. So this is just some quick stats that I was able to pull from the, oh man, I will remember the name of the report. I want to say the Browning Institute. Black people are 12% of the US population, 40% of the US homeless population, 24% of the population in poverty, and 30% of US prison. I actually think it's slightly higher than that. And then many of our children are in families aren't able to have food security. So this is something that was present pre-pandemic. So just imagine how these numbers shifted during the pandemic, especially when people started to lose jobs and weren't able to receive assistance. And that's the next thing I'm going to go into. So the unemployment trend for frontline workers by race and ethnicity, as you can see, unemployment really increased right in the beginning of the pandemic and then began to level off. And it's still not quite back to pre-pandemic levels. As you can see, non-frontline workers didn't experience as much of a spike in unemployment. So now I'm just going to show how education and access to higher degrees and having skilled trade can make a difference in one's job security. So as we can see, percentage of unemployment rate gap between white and black for this is 2 years or 1 year or less of a few college courses. As you can see, they bounce as high as 10% unemployment rate, settling back down to about 5% and then going back up to about 6%, almost doubling off to the pre-pandemic. Then if you look at those that have completed an associate's degree, it almost barely goes above 5% and they correlate well. There's not as much deviation. And then when you have bachelor's degree or higher, you're consistently below 5%, often 4%, and there's not much of a gap in between. So once again, we're seeing if you have access to a higher education or degree, you have the ability to do what, Princess? What is it? The big difference between frontline worker and someone that has a high degree? They have the option to do what?
It's not coming to mind.
Work remote. They don't have to go in. They're more likely to have a job that gives them flexibility and mobility to be able to work from home. Sorry to put you on the spot like that.
Yeah.
But right now, you're the only person that's on my video. Those are on my screen. So I feel like I'm presenting to you. So best practices to help Black communities recover economically. So I think one thing is we often see people, one thing that disturbs me is when I'm watching the news, ABC, CBS, and they're talking about how we can help the Black community, and there's nobody that's Black as part of that discussion. We need to be part of the conversation, especially when it comes to developing legislative solutions, particularly here in our state and in other states where there's larger Black communities. We need to find ways to flow capital into Black businesses. I feel the Utah Black Chamber has a good role in accomplishing that, and they're doing a lot for our community. Go to their page and check them out, the Utah Black Chamber. Our Black Success Center, I think it just opened down on 400 South, and they're going to be doing some big things here in the city, investing in young Black entrepreneurs. And then I think we need to also understand trying to increase our wealth, helping Black Americans to own homes, to have increased opportunity at technical jobs or fields where they're less likely to be on the front line. I know some people enjoy their role, they like being on the front line, but this has led to folks leaving their jobs, even though unemployment is low and people really want folks to work. But are you going to put yourself at risk again? And that's where Black folks are smartening up, like, no, we are not going to do that. We're not going to put ourselves in the line or with employers that aren't going to protect our health, aren't going to provide us insurance, or isn't going to help provide me childcare when I have to go to work, or they're not going to insure my child if my child gets sick because I'm unable to isolate myself from that. So that's it's allowed to sometimes more people, they're returning to school so that they don't have to be frontline workers again. And once again, employers need to do more to protect all frontline workers equally, not just because if you try to protect all frontline workers, that's from healthcare to custodial work to school laborers to retail. You protect everybody equally, then you will have less of these disparities and some folks, one population getting sick more than another. So policy innovations that have assisted vulnerable Black families. So one I'd like to point out is the American Rescue Plan. It provided much needed economic relief. So that the American Rescue Plan and the CARES Act are kind of, they're kind of rolled into the same larger legislation. And that's what allowed you to see, and the reason I have the graph up again is if you look on the right, where you see white and Black and white and Hispanic almost touch, that's when you're starting to see the effect of the checks going out and the economic assistance programs that are beginning to start. I mean, there was almost a 3 percentage point reduction in poverty rate just by the institution of these programs. Moratorium on evictions, enhanced food assistance, such as the SNAP program. What I wanted to point out, though, is when it came to moratorium on evictions, there was a lot of money that did go to states. So the federal government had, I want to say, about $12 billion that they sent out to the states to say, let's help people pay their rent. Well, I don't know if many people knew this, but I think as of March this year, out of the only about 15% of that money has been divvied out to the people that needed it. So there's a lot, the states kind of held on to it for whatever reason, and not given the money that was allotted to help often families in need. I'm not saying that Utah was one of those states. So next thing I wanted to go over was SNAP and the American Rescue Plan. So this led to $3,000 to $6,000 per child tax credits. And that in itself we're predicting that it will reduce poverty by 37% amongst Black communities and 40% amongst Hispanic communities. So it's forecasted to enable people to possibly change careers, to be able to provide more for their family so they can save up enough to then possibly own a home once this inflation and these crazy prices go away, but maybe they can. So it will lift more people out of poverty so that they won't need as much federal assistance in the past to level this playing field. Pandemic employment insurance, that was a particularly effective measure that allowed many Black families to be able to survive, especially during late 2020, early 2021. And collectively, as I said, we're hoping all nationwide, 31% of racial inequalities, should start to diminish as a result of the American Families Plan. This is something that was put forward at the White House, but hasn't made it through the Congress and Senate yet. And that is trying to make what happened with the American Rescue Plan permanent as opposed to temporary. So what are the threats to the Black community and its economic recovery? Well, inefficient delivery of economic assistance. And I just alluded to that earlier, with only 15% of the funds allocated for housing assistance has been dispensed. The expiration of pandemic instigated assistance policies. So there were some people that were dependent on stimulus checks. Also, some of the stimulus checks did not go to the people that were needed. I knew several friends, and of course, people probably saw comments on Facebook about how folks, well, I'm going to use that to take a vacation. I'm going to use that to buy Bitcoin. I heard so many things what people were doing with stimulus checks, and I go, wow, I know so many families that are struggling to put food on their table, or to pay rent, or to pay their utilities, even more so now. And you got people taking vacations to Cancun with their stimulus money. But anyhow, that is a threat, I think, to further recovery. And now we have inflation effects, which some of it is market manipulation, but we won't go into that very deep unless we want to engage in it during the Q&A. There's also going to be mismatches between employers and employees. So, and I was getting to this earlier with the Great Resignation that people often, I think it's phrased as now. There are folks that are trying to hire, but folks don't want to go back to that job anymore. So people now need to change or increase opportunities that maybe will give people remote options so they don't have to be exposed to be able to continue their careers and provide for their families. And then one thing that I think we haven't seen yet is the disruption that occurred to children, particularly 18 and under, with going to school and disruption of their subjects, particularly those between first grade and I would say sixth grade. That's like your formative time when you're learning your basics for early math, reading, and writing. We may have soon a generation, because they didn't have a family member that could stay home with them to teach them or to homeschool them. So thus they watched television, or it was more important that they had a babysitter than someone to be able to afford the ability to teach. So you've got these kids going back into school and they're behind. And that's thousands of children that are behind, probably millions. But I don't want to speculate too much because I don't have numbers on that. But many people here in the call had to keep their kids from school. And I'm sure many parents were frustrated on how is my child going to stay up? How are they going to maintain their GPA if there's no exam or test to take? Children need to be challenged. Children need education, scholastic activities to be able to be to be able to contribute and to be a wage earning member of society once they get through school. And that's what's going to be impacted that we have yet to see as a result of the pandemic. So in summary, Black families are face hard trade-offs than other families may not have to experience as a result during this pandemic. They often had to decide between health, scholastic activities, and job security. So once again, that's going back to that snowball or domino effect of, well, if my child is sick, I have to stay home, but I'm being requested to come in because I'm a frontline worker. I'm necessary. So let's say if you were a subway driver in New York City and you're a single parent and your child can't go to school, either school's closed or they're sick and you need to stay home with them. So you risk losing benefits, you risk losing income. We need to be able to secure those gaps more for the next pandemic, because there will be another one. And state and local governments need to promote clear and concise and consistent policies. As I stated earlier, reading the quote from the school district worker where she didn't feel safe or protected when she was at her place of work. They gave her one mask, didn't necessarily give her a week's worth of masks every week so that she could protect herself at home and when she's out in the public, still putting those at her job also at risk. So that would be it for me. Here's some of Brookings Institute. That's what I was trying to say. Anyway, I will stop sharing. Any questions? And Princess can answer them as well.
Well, you did offer. So can you elaborate a little bit more on what you meant by market manipulation and its impact?
Yeah, I'd love to. So who asked the question? I need to get out of my.
It's Amanda.
Amanda. Okay, yes. So I look at it this way. So for example, let's take gas. So gas right now is it necessarily costing more to drill? No, but it may be costing more to ship. So if you increase the cost to offset the effects of the pandemic, particularly by logistical hindrances, you should, if you adjust by that, you shouldn't necessarily be doubling your profits as an oil company, which they are. So I think we also have to see that companies are, in a way, yes, they will claim inflation, and then they're going to up price even further because they're thinking people aren't going to realize that, oh, it's just inflation driving it. But really, you're charging more than just an inflation aspect that's factored into the price, or just something was held up in Shanghai for 4 weeks before it could get out. Why all of a sudden is the price 2 or 3 times that? So it's to me, I compare it to when somebody bought all the hand sanitizer in New York City back in 2020 and then started selling it for $10 and $12 a bottle when it's $1 at the store. It's like when someone wants to sell a generator after a hurricane and he bought it from Home Depot in another state, and then he knows people need it and they're in crisis. So something that costs $100, he's selling for $2,000. So that's what I'm saying about manipulation. Essentially, I feel that some companies are gouging right now. They're not trying to stay afloat.
I agree with that. We had an instance of that, and I know this is very minute, seems small, but it is a good example of we went to the movie theaters, and normally when you buy a large popcorn, you get a refill, right? A free refill that comes with that. And we usually go with a bunch of kids, so we buy one, everybody fills up their bowl there, and then we just refill it so we don't have to come back out. And this and this was just a couple months ago, the theater said, oh, we're not doing the refills anymore because of COVID. And I know it seems small, but effectively they doubled the price of the popcorn, thinking that people wouldn't really notice, but I did notice because it's already kind of ridiculous. So it's a small example, but I definitely agree with you where a lot of stores or organizations are using COVID as an excuse to gouge people.
Yeah, or the pandemic at this point.
Pandemic,
So
yeah.
some things are reasonable, which can be explained, but when they're going much higher than they should be, like I had to buy a flight to go to Minnesota in the summer that was $1,400 in the middle of June. And I was like, wow, gas really is affecting the price that much when a year ago it would have been less than half that. But until businesses are regulated and they're stopped from being able to do that, they're going to do it. So.
Yeah, thank you. If there's no more follow-up questions on that, there's another question here. In the middle of your presentation, you mentioned equality and that wanting to provide, for example, in the hospital, you said the same amount of supplies for each person, so there wasn't as much disparity. So my question is, even though there might be no disparity necessarily in the workplace, there can be based off of the number or percentage of people that person is responsible for taking care of. So you mentioned how multiple families live in one unit, and that was one of the issues with COVID spreading. So when we're talking about frontline workers and we're talking about equality, but we're trying to also eliminate disparity, what ways do you think organizations could implement a change that comes across as equitable but still meets the demands of a family social normalization or whatever? I'm trying to think of the word, I've lost it. Those families are still like that, and so they need more, but that doesn't necessarily create equality. We're trying to create equity. I know it's kind of a weird question.
Yeah, and if I had a typo there, I meant inequities, not inequalities, if that was what you were referring to earlier. But to answer your greater question of what solution can a community, can a state, can legislators, can the federal government provide when it comes to frontline workers being protected, and as well with when some people are too crowded. I think one thing that the state is trying to address is affordable housing. So we need to get people to spread out more, and we need to be able to build more affordable housing as opposed to more $1 million condos. That's not more of what Salt Lake needs for growth. But if there's a willingness to pay, they'll probably keep building those. The other thing that I feel would probably be most helpful is to create state regulations that believe in the science to protect people's health. And we should need to take politics out of anything that's science driven. We really need to remove that. We shouldn't have to, it was politicized early on, and some of that still lingers to this day, and its after effects, and that also affects funding. And then that leads to people wanting to take something to the court because an employer wants to make a mandate that everybody has to do a certain thing. And so then they sometimes want to get federal protection, and then the federal protection will go to the court. It's too bad. I don't know if it will happen in our generation, that more people, we will be less cult-like and less partisan when it comes to deciding issues for the health of ourselves and our loved ones. But that's one thing, affordable housing and trying to support employers that want to protect their employees. And the state needs to do it, the county needs to do it, federal government needs to do it.
Thank you. So just to summarize, affordable housing and making sure that we are more proactive in the community when it comes to voting for our politicians that are in House and Senate. So thanks for sharing. I have a question here that is a little awkward, but I'm going to read it as written from the individual. and I disagree with it. But it says, I've heard some people say that Blacks have been using the pandemic as an excuse to be lazy and not work and to get on welfare and unemployment. What are your thoughts on that?
Well, one, I think that it's untrue. One, because we can't all be grouped together like a monolith. We must understand that welfare greatly benefits poor whites in this nation more than any other demographic group. So I think I would look there first if there's graft or fraud occurring than amongst Black Americans. So yeah, that's not what I've heard. It's not what I've seen. And people are struggling out here. So, but I think they need to look at the majority first before pushing that type of misaligned trope.
It's kind of like propaganda, just a way to manipulate and discriminate.
Well, it's not new though. I mean, the back in the 80s, it was often pushed. Many Black folks in the inner city were, there were welfare queens. That title was used or term was used a lot. And it was often used to denigrate Black women that were in the inner city that didn't have many opportunities to live where they were at.
For sure. Actually, that leads into a question that I had been thinking of when you were talking earlier. Something that I've noticed in poor communities is it's a pendulum. So people who are very, very poor will have more state assistance. And then, things like education, childcare support, food stamps, support for housing, all the various programs. And as they move up in their companies or they get more education, those benefits begin to decrease. And then it comes to a point where it's equal, where they can take a promotion and now they have to pay for childcare, or they could stay in their position and have more time with their kids. Can you talk about how that could impact communities and what can be done to support people who are attempting to transition from that period of time where they can either have benefits or they can work and their standard of living is pretty much the same?
So you're saying, how do you convince people to no longer request or seek assistance that's federally subsidized versus going into job training to try to get a different job so they could improve themselves that way and change maybe their living conditions? Is that what you're saying?
So for example, I'm from a very poor area in Missouri, and the struggle that I've seen in a lot of the communities there is single moms, currently receiving government assistance. They go to school, they're trying to do better, but they have young kids. And so as they earn more money, the benefits they receive reduces. And so there's a breaking point, right? Where they can work more or they can be home with their kids and be receiving benefits. And for me, it's very easy to understand why I would choose to be with my family rather than work at a job. Most people probably don't like their jobs anyways. So that's kind of what I'm wondering. Is there something we can do to support them, people who are really trying hard to transition over that breaking point?
I think maybe trying to introduce them to community college and tech college program and tech schools, and making sure they can get funding or grants to support them for just changing their job. Mind you, it's hard if you're stuck in an area where there's no investment in the community. I can think of several states that are like that. Northern Louisiana, most of West Virginia. You can't really say this to someone in those that particular state. We can use West Virginia or even Southern Alabama. Go to a trade school or try to get assistance from a community organization so you can change careers. So you can go into nursing, or you can become a phlebotomist. You can increase your pay per hour so you're not part of this living paycheck to paycheck or just choosing to stay on assistance. But if there's no school around you, if there's then no place to get a job once you have this additional degree or training, then you're kind of stuck there. And then once again, you go back to, do I need to help this person leave this area? That's the harder thing, especially if they've got family ties or they've got a number of children and it's hard to uproot and leave. That's going to take probably several tiers from city, county, and state level to have investment where they are to care about those citizens. It's not gonna, I think it's not gonna be a community organization would make enough of a dent. They would make a difference in maybe 1 or 2 families, or maybe a dozen, depending on how the resources of the CBO. But if the state and private companies aren't willing to invest to bring jobs there, I don't see it changing. So yeah, I could understand if someone would stay on assistance, because I would have more to provide for my children. I know I'll have SNAP. I know I'll have employees assistance.
Thanks for sharing. Since you mentioned one of the problems being jobs, what do you think the impact on COVID and working from home can have for those communities? Because, you know,
I think it'd be a great improvement if people could work from home. I'll tell you right now, I work from home about 85% of the time with my administrative role. And I want to say out of our 72 employees within the, well, let's see, I think there's about 54 employees. We have employees in Arizona and Utah, but I'll even use the ones in Arizona. So out of 72 employees, I'd have to say 65 of them work from home on a daily basis. And only a few come into the office because they need to. Even our executive assistants and secretaries, they don't stay full-time there. I think going into an office space, unless it's required, and if you set your employee up to be able to work remotely, you shouldn't. I would totally support and encourage anyone to work remote, unless you're, you're clinically, like I do have to go to the ER and see people. Mind you, I never caught COVID from the ER. Always caught it from a loved one.
thank you. I appreciate you sharing that. It sounds like it would be a great opportunity for tech companies to step in and support companies,
Oh yeah.
rural communities. So that's awesome.